Morning, everyone. Thank you for giving me the opportunity to present my poster with title Frequencies of STIs and Mucocutaneous Manifestation in Elderly HIV Patient in Yogyakarta. Let me introduce myself. My name is Dr. Alessandro Alfieri. I am a resident doctor at Department Dermatology and Venereology, Faculty of Medicine, Public Health and Nursing, University of Gadjah Mada, Yogyakarta, Indonesia. First, let me start by giving you some background information about this poster. There is an increasing number of the elderly population infected with HIV in the world. This is caused by the longer life expectancy of people with HIV and AIDS taking antiretroviral therapy. It is estimated that the percentage of people living with HIV and AIDS aged 50 years and over has increased by more than 17% over the last decade. The risk factors for HIV in the elderly population are the same as in other age population, and the main source of transmission is unprotected sex, either vaginal or anal. The presence of these risk factors also increases the incidence of sexually transmitted infection in the elderly population. In addition to STIs, HIV infection is also associated with mucocutaneous manifestation. This is important because more than 90% of patients has at least one symptom in their lifetimes. There are very few studies that discuss mucocutaneous manifestation in the elderly population with HIV. This study aims to examine the frequency of STIs and mucocutaneous manifestation in elderly HIV patients. The study was conducted retrospectively using secondary data. Demographic data of the subjects were taken from medical records at the STI outpatient clinic Dr. Sarjito General Hospital Yogyakarta from September 2017 until August 2021. Demographic data were age, gender identity, risk factors for HIV and STI, time since HIV diagnosis, ARV regimens, STI manifestation, and mucocutaneous manifestation. And the classification of the elderly is based on the regulation of the Minister of Health of the Republic of Indonesia number 25 of 2016 concerning the National Action Plan for Elderly Health in 2016 until 2019, which divides into pre-elderly age 45 to 59 years old, elderly age 60 to 69 years old, advanced high-risk age more than 70 years old. Based on our finding, during 4 years, there were 123 HIV-positive elderly patients who visited the STI clinics, consisting of 92 men, 30 women, and 1 transgender. The mean age in the study was 52.70 years old and was dominated by the pre-elderly groups. As many as 80.5% of patients were taking antiretroviral in the form of tenofovir, lamivudine, and efavirenz. And the mean length of time diagnosed with HIV in the subject for the study was median of 33 months. The highest risk factor for HIV in this study were men who have sex with other men, followed by bisexuals and clients of sex workers. The most common manifestation of STI were condyloma acuminata and latent syphilis. On the other hand, for mucocutaneous manifestation, xerotic skin and pruritic papular eruption were the most common clinical symptoms. In conclusion, let me sum up my main points. This study shows that the pre-elderly groups and male sex group are at risk for HIV infection and STIs due to deviant sexual behavior that usually occurs in younger population. The frequency of STI is around 15.5%, which transmission can occur either using or not using a condom. Mucocutaneous manifestation occur in 24.39% cases. Preventive intervention is needed in the form of safe sexual behavior in preventing HIV infection and STIs in the elderly patient. Thank you for your attention.